Okay, and so over the course of the show, we're going to talk about those big three that you just mentioned, the omega-3s, the omega-3 fatty oils, vitamin D, and probiotics. And you did mention to me, and it is on our tips later on in the show, that you should consult your physician or naturopath before taking any sort of supplementation.
Absolutely. We're going to make some recommendations today, but by no means does that mean for patients to go ahead and just start taking these, because they're probably on a good dose. They need to consult with their healthcare professional. I think it's extremely important because there are, no matter what, natural medicines, of course, they have less side effects, but there is some interactions that could take place. And based on that, you just need to know what other medications you're taking. And a practitioner like myself or a medical doctor will understand some of these interactions. So I think it's really important for them to let them know.
So do you work hand in hand or, in cooperation with a medical doctor?
Absolutely. In terms of my practice, we have 4 medical doctors there. And of course, there is this cross-referral system that takes place because sometimes patients really don't get the answers they're looking for, and maybe they request other options, and that's when the medical doctors in my office say, listen, I can't help you with that. You need to see an expert or somebody who knows about natural medicine, and that's when they will refer to me.
Which is great, because I think a lot of people, there's this myth that it's one or the other. You either prescribe or subscribe to Western medicine or more of a natural alternative medicine, but it doesn't have to be that way. You can take bits and pieces from both worlds.
Absolutely, absolutely. And I think that's the idea, and how to, in today's modern day medical model, if you will, it has to be this integrative approach. And it's this holistic approach where you look at the patient and say, well, you're on this drug. A lot of patients come into my office and say, I'm taking this drug, I don't wish to take it. Well, unfortunately, I'm not going to take you off this drug, but I'm going to give you something that's probably going to help another condition that you have and that won't interact. But of course, you need to bring it back to your medical doctor and say, is it okay? So maybe in the long run, if you talk to your medical doctor and we will work together, we can actually lower some medications. For example, if it's a heart hypertension problem or high blood pressure, maybe they're on a high blood pressure pill and they'd like to lower it naturally. They can do some dietary interventions, maybe some weight loss programs, and we can show them that their blood pressure will start climbing down. If that's the case, they can go to their medical professional and say, look, my blood pressure is coming down. Is it okay for me to get off this pill? And at that point, the physician or the medical doctor will say, absolutely. And so that's how we work together with the system.